Now we're going to have Dr. Jacky Davis, who's going to move forward to the lecture.
Thanks for inviting me here this evening. Everybody's full of admiration for what you're doing and what we know in Camden as the London Borough of Crackertown, I think you're called now. And people like you and Bersham really kind of show the way to others who are really challenged. So I see you as sort of, leaders in all of this. I've been asked to talk about the NHS tonight because the NHS is a kind of paradigm for what's happening to public services in this country. And so I've just been asked to give you a bit of background to it and then perhaps what we can do about it in my 5 or 7 minutes. Behind the problems at the moment, there are two massive challenges to the NHS. One is the reforms that were pushed through by the government and which are already sort of unravelling. GPs are finding themselves, as you probably know, are responsible for cuts and closures. They're walking away from the commissioning that was supposed to give them all this power. And when they go against the government ignores them. And that's what happened in Lewisham. The local GPs wanted their hospital to stay open. It was all around the PF5 project. It's been so eloquently described by my colleague here. And Jeremy Hunt took them to court. They took Jeremy Hunt to court. He lost. He took them to court again. That's all our taxpayers' money being wasted. But that's how much they care about what the doctors and the public think. Despite government denials, the NHS is being privatised at the moment. 22 out of 24 big contracts recently have gone to the private sector, and the private sector are really behaving predictably badly. At the same time as that's going on, the NHS has been told to save £20 billion over 4 years, and the result is kind of collapsing under the weight of that financial pressure. The figure of 20 billion came out of McKinsey's report. McKinsey is one of the big management consultancies behind a lot of this stuff. They write a lot of this policy, and they came up with £20 billion. I think what's extraordinary about £20 billion is that we can bail the bankers out for billions of pounds, but we cannot bail the NHS out. And what we're seeing at the moment in public services is the privatisation of the profit and the socialisation of the risk, as you know. There's a huge undercutting of the services going on at the moment. Anyone who saw my article in The Guardian today, I would refer you to that, wouldn't I? But I listed some of the figures there. 20,000 nursing posts have gone since the coalition came in, gone or frozen. That's not what the government's saying, but that's what the RCN is saying, and who I'd rather believe. 8,000 beds closed, A&E doing its worst ever. And what we've got is the government running down the NHS while they are claiming that it's failing. This is the name of the game of public services at the moment. It's run it down, say it's failing, flog it off to the private sector because they're going to do it better. Well, that's their ideological position. At the same time, there's a real problem for London because we have got a beds crisis. And when they start talking about this A&E crisis, there was this report that came out yesterday. I talked to somebody who's an A&E consultant down at London who said the real problem is there are no hospital beds. We have lost 50% of hospital beds over the last 20 years. So when they get these very sick patients in casualty, and I work in a hospital not far from here, sick patients do turn up. I mean, the government wants us to believe otherwise. There is nowhere to send them. And so, of course, all the problems of the NHS are crystallising around the A&E departments at the moment. And the answer is not to close down A&E departments. That is completely crazy. Yeah, it's crazy. I absolutely agree with you. But and my colleagues already referred to PF5. This is the most enormous scandal. You know, taxpayers are going to be paying something like £66 billion for £11 billion worth of hospital buildings in this country. And the hospitals that took those debts on are now being crippled by them. And I'll come at the end to what I think we should do about it. The whole A&E thing we can talk about afterwards, it's quite complicated, but they're telling us lies about it. They keep talking about strokes, they keep talking about major trauma and heart attacks, and of course those patients do need to go to specialist centres, but the fact of the matter is they are less than 5% of A&E attendances. And the story about what happens to those patients is being used to close down A&E departments which are actually needed for children with asthma attacks and people with broken legs and all the rest of it. And they're completely ignoring that. My message today is really, it's a very depressing situation, but I don't want people to lose heart. And that was one of the reasons I wrote that article in The Guardian today, because I went to a meeting on Saturday where people were coming up to me and saying, oh, it's dreadful, we've lost the NHS. And I absolutely want everyone to go away tonight thinking we haven't lost the NHS, but we do need to fight for it.
I agree.
Good. I like everybody to agree with me. It's like me saying, what I said, I think there are three things that really need to be done very, very quickly, and they do involve the Labour Party, who have been, I'm sorry to say, along with the unions, have not shone over their treatment of the NHS. Labour need to say very loud and clear immediately, we will reverse this bill, and we will make the NHS the preferred provider, which was what Burnham said at the end of the last Labour government. If they say that, it will put off the likes of the big four outsourcing companies, who I'd really like to discuss, because there was this National Audit report on them yesterday. What a scandal that was going on there. It will put them off getting involved in the NHS because they're going to be kicked out in a couple of years' time. So Labour have to step up and do that. Labour have to say, please, no more bed closures, because that is where this crisis is coming from. David Owens, Lord David Owens, has set up a bill for the Secretary of State to take back responsibility for the health service, because the Tories got rid of that when they pushed these reforms through. It's a very technical thing, but that's why Jeremy Hunt, nobody's responsible for the NHS anymore. That's why they all sit around criticising it. And we need to centralise the PFI debt so that it's not crippling individual hospitals, which it is at the moment. So, to finish with, we can save the NHS, and I'm just going to quote Bevan's words to you, because I think they're very moving, and if you haven't read Bevan's autobiography, In Place of Fear, it's a fabulous book, and it could have been written yesterday. It's really inspiring. He said, medical care is a communal responsibility available to rich and poor alike, according to medical need and no other criteria. No society can legitimately call itself civilised if a sick person is denied medical aid because of lack of means. And that's what we should be living by those words in the NHS that we set up. Nobody says the NHS shouldn't change, but those fundamental principles shouldn't change. But unfortunately, faced with this coalition government, we do need more than words. We need action. And Kennedy used to like to quote Dante, who said, the hottest circle of hell is for people who at a time of moral crisis, preserve their neutrality. I don't feel much neutrality in this room, but you know, we have to go out and fight for what we want. So, finally, the only good thing is the wheels are coming off very quickly, and Cameron's in a panic now. He's asked for weekly reports on what's going on. Hunt has asked the private hospitals to stand by to take NHS patients who the NHS can't cope with. That's what they reduced us to. So if I made you angry, that's good, because you've got to get angry and then you've got to go out and fight this lot. I am going to hold this up. This is the book we wrote, NHS SOS, Who Betrayed the NHS and How You Can Save It. I happen to have some copies with me if you're interested at a reduced price. Read this, because the last chapter is what you can do about fighting back. You can't do it as individuals, you can do it. Join your local group, join Keep Our NHS Public, join David's group, do whatever, but don't let these bastards get away with it, because it's our NHS, not theirs, and we've got to have it back from them. Thank you.